Hi David, my name is Alice.
8:30 this morning and the start of a shift for physician associate Alice. With 2 years of postgraduate training, she helps care for patients here on the diabetes ward. But concerns that PAs are substituting for doctors has fuelled, in the words of the Health Secretary, a toxic debate. So now a review recommends physician associates in the NHS in England should be renamed physician assistants. It says they should not be allowed to see patients with undiagnosed problems, and they should work in a hospital for 2 years before they can work in GP surgeries.
What I hope to achieve is a reset. It's been a really difficult time. There has been a lot of confusion and conflict, and we need to move forwards with much more collaboration.
Would you feel happy with yourself or a member of your family being treated by a PA?
It would depend what they were being treated for. That's the crux of it. So to answer your question, yes, I would be confident to be treated by a PA, depending on what was wrong with me, and that it was a simple, straightforward issue.
The review looked at the deaths of 6 patients. Emily Chesterton was one of them. She died of a blood clot in her lung after she was misdiagnosed by a PA she thought was a GP. Her family have campaigned for these changes.
In Emily's situation, it would have meant the difference between life and death. It's been devastating for us. We'll never get over the loss of Emily. There's nothing else we could have done but to try and change things.
There are currently almost 4,000 physician associates and anaesthesia associates in the NHS in England, but there are plans to increase that to 10,000 in the coming years. Some say the changes recommended in this review will only increase pressure on the NHS and lessen the chances of cutting waiting lists.
We are not hitting cancer targets, we are not hitting elective operations targets, and we are not getting people to see their GP quick enough. We were brought in to help those very things, and the person that suffers the most from this report, if it's adopted wholesale, is the patient.
The doctors' union, the BMA, says the recommendations are inadequate. The government says it will implement them as quickly as possible. Rebecca Barry, ITV News.